Hi, folks. Jeff Jones, Vice President, UFCW Local 1459, with an update for Wednesday, October 28th. I had originally intended to respond to the latest piece of misinformation coming out from President Tyrone Housey on his website, but I found something more important, and that kind of stuff that is basically a distraction from the real issues can wait for another day. What I'd like to talk to you about is our health insurance plan. And I'd first like to apologize to all of you members who are not part of our health and welfare plan. We represent 60 odd contracts. Only some of them are in the health and welfare plan that we administer that's about to go into a merger. And this doesn't directly pertain to you in terms of numbers, but I think it does pertain to you in terms of the kind of leadership that you should expect from the local. And we will definitely, in another video or videos, take up issues that are more specific to your workplace, and you're a very important part of our membership, and we take that seriously. But right now, I want to talk about Stop and Shop members and those other units. There are additional units that are in the health and welfare plan right now. So, as you know, there was a strike last year in 2019. We were out for 11 days. We reached a tentative agreement for 3 more years. An important part of that was health insurance. And what came out was preserving the health plans of the 5 locals into a combined plan, a New England healthcare plan, which you would think would result in a better overall package because you're combining resources, you're streamlining administrative costs and whatnot. So it should work out. We did expect a little bit of a bump because of the 5 plans, of the 5 locals, 4 plans, 5 locals. We had the best plan, in my opinion. I think that's pretty fair to say. Best benefits for the cost. And so we expected that when you blend them and homogenize everything, there would be a little bit of a tick. But you may have recalled getting the union leader, our union newspaper, and the president's report, in which he talked about there would be quote unquote some increases in the costs of the benefit plans because of that blending that I just talked about. But this is basically completely wrong. You don't just have some increases. You have, in some cases, things doubling. You have your copays going up. You have your deductibles going up. You have your out-of-pocket expenses going up. You have your non-provider network. There used to be a cap on how much you would eventually get docked. There's no cap now. It's like open season. You can go for it. So let me read off a few things here, and we're gonna post this so you can read it in detail. But deductibles are going to double. For in-network providers, the individual deductible will change from $150 to $300. That's doubling. And the family deductible will change from $300 to $600. For non-network providers, the individual deductible will change from $500 to $800, and family deductible will change from $1,000 to $1,600. As I've already said, there's no limit to what members will pay out of their own pocket if they use a non-network provider. So previously there was a limit of $5,500 for individual and $11,000 for a family. Now it's like open city. Out-of-pocket costs for using in-network providers. These are the people that the plan wants you to go to. Those costs are doubling. Members' out-of-pocket costs will increase from $1,150 to $2,500 for an individual and $2,300 to $5,000 per family. Employees end up, and the bottom line is, you end up contributing more money for less insurance commencing in July of 2021. So the employee contribution will increase from $14 to $19 for individual coverage and $28 to $38 for family. That's an additional $5 or $10 from your paycheck every week for less benefits. There are other things to talk about, but there's that. The numbers are bad enough in and of themselves, but like I had already mentioned in an earlier discussion about how the pension was rolled out, here you have leadership that's basically afraid to engage with the membership. And the other thing you should know is both Dean Ethier and I sit on the Health and Welfare Trustees Committee, and both of us were cut out of the process. When it came down to plan design, neither one of us were there. Neither one of us were asked to be there. Okay, so this is a decision. This is what the president would have you believe is what he does, such that he doesn't have any service assignments like the rest of us, because he has to devote important times so that you can have your deductibles double. Now, is that what you expected as a Stop and Shop employee when you were on a picket line for 11 days? Now, we knew that there were going to be, some bumps with the health and welfare. I mean, that's perfectly fair and understandable. But anybody that was on a picket line think that your deductibles were going to double? Anybody think that you were going to contribute more money for less insurance in a merger plan with the New England locals, all merging their resources? I didn't. And you shouldn't either. And you should be mad. And you should be insulted. And this basically gets down to leadership. We're all going to have times where things don't work out right. We go for stuff in contracts and we don't get where we need to go for whatever reason. Stuff happens. But the true measure of leadership is that you have communication about that. And you explain it to the membership. And for those of you who watched my earlier video on kind of clarifying what really happened on certain things, you'll see a pattern here. Because when I talked about the pension plan, I don't want to talk about the numbers. I was more interested in how was it rolled out? How was it communicated to the members? And we know what happened there. Basically, we had a meeting called at 3:30 in the afternoon on a day, and a Zoom meeting, and that was it. Take it or leave it. You had to pre-register to get in. And out of, again, ballpark 1,200 people, we had a whopping 60 people show up. And yet, in the president's report, again, the same thing that you got, look it up. He says this pension plan was approved by the membership. I'm sorry. The membership wasn't even there. 60 people does not constitute the membership. And this is what you got. And so this is why we're running members first. Because we're going to be more transparent. There are going to be times where things don't work out. And when they do, we're going to communicate that to you. We're not going to try and hide it. We're not going to try and run away from it. And we're certainly not going to put something out like this that says we secured improved benefits. We're not going there. That's really not part of our platform. We're going to try and be as transparent as we can be and explain things to the best of our ability and work for you, the membership, to the best of our ability. And that's why we're running the slate that we're running. And that's why we're asking for your support on November 10th, 9 to 12 in the morning, 6 to 9 p.m., in person. We need you to show up, make a difference, and move this local forward, because solidarity works.